After the age of 60, many men begin to notice that their bodies are no longer as responsive as before. Waking up in the morning is often accompanied by fatigue, decreased sexual desire, and a feeling of insecurity that creeps into every action and gesture. Many blame age, others believe that their hormones have declined irreversibly, and many resign themselves to relying on drugs or temporary measures. However, in reality, the underlying cause is often not age or hormones, but a mechanical problem that very few people pay attention to. Blockage or stiffness of the pelvic floor muscles, especially the perineum, the area between the anus and the testicles. The perineum is not just a simple anatomical part, but an important switch that regulates blood circulation in the pelvic area. This is where blood begins its journey to the penis and prostate, helping to oxygenate the tissue, supporting erections, and maintaining overall physiological health. When the muscles here lose flexibility, become tight or constricted due to a sedentary lifestyle, stress, or prolonged sitting, the entire circulatory and nervous system of the pelvic area will be affected. As a result, the body is no longer able to respond physiologically naturally, leading to decreased libido, weak erections, or even erectile dysfunction, and an increased risk of urinary disorders and prostatitis. The important thing that most men do not realize is that male power does not disappear, it just sleeps. Perineal is the key to awakening this energy. When properly activated, the pelvic floor muscles can improve blood circulation, reduce muscle tension, and reestablish important nerve connections, thereby restoring natural erection ability and masculine confidence. This is not a miracle or an enhancement drug, but a mechanical process. The body heals itself when reminded, exercised, and cared for properly. Therefore, instead of accepting the decline as inevitable, men after 60 should focus on restoring the flexibility and strength of the pelvic floor muscles, especially the perineal area. Recognizing and affecting this point will make a big difference. From improving sleep, increasing energy, to restoring desire and a sense of control over the body, this is the first but most important step for every man to feel his strength and vitality again, regardless of age. One of the simple but extremely effective solutions to restore male power after 60 is perineal massage, or in other words, direct impact on the perineal area between the anus and the testicles. With just 1 minute a day, this method can make a big difference in reactivating blood circulation, improving tissue oxygenation, and reducing muscle tension. All important factors that help the body to respond naturally physiologically. It is important to remember that perineal massage is not a temporary or drug-based measure, but a natural mechanical recovery, helping the body to reestablish its inherent function. Performing perineal massage correctly requires attention and patience. First, choose a comfortable position, either lying on your back or sitting upright. Place your fingers gently on the perineal area without causing pain, without exerting, and make circular, regular movements. Another important factor is deep breathing, synchronized with hand movements, to increase blood circulation and support the body to completely relax. Focus on muscle activation, not pleasure or external pressure. This is the core difference. The body needs to be reminded to function normally, not affected by temporary feelings or chemicals. Many men often ignore this method because they think they need drugs or complicated devices to enhance physiology. However, when the pelvic floor muscles and perineal area are properly activated, the entire pelvic circulatory and nervous system begins to function more smoothly. Blood circulates better, more oxygen and nutrients reach the tissues, the nerves respond faster, and the prostate is also released from pressure, reducing the risk of inflammation and urinary disorders. Just 1 minute a day, persistently and continuously, you will notice deeper sleep, increased energy, desire, and natural recovery of erections. Perineal massage is not just a technique, but a self-care ritual that reminds men that their bodies are still full of vitality and resilience. It is a way to regain confidence, to restore the sense of control over their bodies and the masculine energy they once had. No drugs, no complicated medical interventions, just a minute, perseverance, and the right focus, and you are rewriting your own physiological health story day by day from the very foundation of your body's natural mechanics. One of the most vivid and convincing proofs of the effectiveness of perineal massage is the case of Julian, 67 years old. When he came to the clinic, Julian encountered common problems in men after 60: frequent fatigue, disturbed sleep, decreased libido, and lack of confidence in sexual life. Initially, he believed that this was an inevitable consequence of age, but through the examination and discussion, we discovered that the main problem lies in the blockage and stiffness of the pelvic floor muscles, especially the perineal area, which controls blood circulation and supports natural physiological responses. We instructed Julian to perform perineal massage properly, 1 minute a day, combined with deep breathing, focusing on muscle activation and not on pleasure. The important principle is to be persistent and regular, creating a daily ritual to remind the body to react normally. At first, the sensation may be gentle, just warmth and moderate pressure, but it is this regularity that stimulates the pudendal nerve and pelvic blood vessels, improving circulation and tissue oxygenation. After 3 weeks of persistence, Julian reported noticeable changes. Erections matutinas appeared naturally, indicating that testosterone was back in action. His sleep was also deeper, with less fatigue when he woke up. Blood circulation improved. His overall stamina and energy increased, allowing him to clearly feel the difference in every movement, every step. Even Julian's mood and self-confidence were restored. He became more energetic, full of a sense of masculinity, more actively engaged in social activities and connected with his family. Julian's case demonstrates that perineal massage is not a temporary solution or a booster, but a natural mechanical recovery method, helping the body to restore its inherent functions. It reactivates the pelvic circulatory and nervous system, relieves pressure on the prostate, increases tissue oxygenation, and regulates the male physiological response. Actual observations show that just 1 minute a day, regularly and with the right technique, can bring about remarkable changes in physiological health, sleep, energy, and mood. This confirms that male power is not completely lost with age, but sometimes just falls asleep and only needs the right impact to awaken it. Julian is a living testament to the power of proper body care, reminding all men that resilience is always present, regardless of age. Understanding the physiology behind the effectiveness of perineal massage is the key step for men to see the true value of this method. When performed correctly, the massage focuses on the perineal area, the central point between the anus and the testicles, where the nervos pudendus, the important nerves responsible for controlling the urinary sphincter, erectile response, and maintaining prostate function, converge. Activating these nerves not only improves erectile ability, but also affects the autonomic nervous system, helping to balance physiological responses, reduce stress, and increase the body's sensitivity to hormonal signals. One of the common problems in middle-aged and elderly men is pelvic circulatory congestion, leading to reduced tissue oxygenation, prostatitis, and asynchronous hormonal responses. Perineal massage acts as a biological opening valve, releasing buildup pressure, softening the pelvic floor muscles, and stimulating blood flow to the penis, prostate, and surrounding tissues. When blood flow is improved, tissues are supplied with adequate oxygen and nutrients, creating an ideal environment for the body to regulate its own hormones, including testosterone. In addition, regular massage also helps reduce inflammation of the prostate, an important factor affecting physiological and urinary function. When the muscles and tissues around the prostate relax, pressure is reduced, inflammation is reduced, and erectile response and urinary control are improved. This not only brings physiological benefits, but also improves sleep quality, mental health, and overall energy. Thus, the mechanism of action of perineal massage is a subtle combination of nerve stimulation, improved circulation, and natural hormone regulation. It helps the body restore its internal balance, unlocking physiological responses that have been slowed down with age, and restoring functions that many people think have been lost. This is not a temporary method or stimulant, but a natural recovery by activating the biological mechanism inherent in the male body. Once men understand this mechanism, they will realize that a minute of massage a day is not just a simple technique, but a means to awaken the body's deep self-healing ability, improving circulation, hormones, and confidence. This is the reason why this method is effective in the long term, helping to maintain and regenerate male strength, regardless of age. To get the best results from perineal massage, it is important to do it at the right time and with the right technique. Many men over 60 often ignore this detail, leading to unclear results despite perseverance. The first advice is to choose a quiet time when you are not interrupted by work, phone calls, or surrounding noises. The ideal time is in the morning, right after waking up when the body is still fresh, or before going to bed when the nervous system and blood circulation are preparing for deep sleep. At this time, the body will easily receive signals and activate self-healing mechanisms. When starting the massage, gently place your fingers on the perineal area, located between the anus and the testicles. This is the center of the nervos pudendus, the nerves that control the urinary sphincter, erectile function, and support the prostate. The massage should be performed in slow, steady circles, combined with deep and rhythmic breathing. The goal is not pleasure, but to stimulate blood circulation, reduce congestion, and improve tissue oxygenation. There should be no strong pressure or pain. A gentle, warm, rhythmic feeling is a sign that the body is responding correctly. The next important principle is to be consistent every day. It is only a minute a day, but if done regularly, the body will remember how the pelvic circulation and nerves work. Like training a muscle or learning a new skill, repetition helps the body resynchronize its physiological response, increase blood circulation, reduce prostatitis, and improve natural erectile function. Many of my patients have shared that, after just 2 to 3 weeks of consistency, they notice noticeable erections, matutinas, deeper sleep, improved spirits, and a significant recovery in self-confidence. Ultimately, consider perineal massage as a self-care ritual, not just a medical practice, but also an opportunity for men to connect with their bodies and recognize their inherent self-healing abilities. When done correctly, at the right time, and consistently, 1 minute a day can be a powerful tool for maintaining energy, strength, and masculinity, regardless of age. This is why I always emphasize the body can heal itself if properly awakened. One of the important messages I always want to convey to men after 60 is, your power is not gone, it is just sleeping. Many people mistakenly think that age means loss of desire, fatigue, and decreased energy, but in fact, the body still retains its inherent potential. What we need to do is reactivate the natural mechanisms, and perineal massage is a simple but extremely effective tool to do that. This is not a trick, not an advertising gimmick. It is a medical action based on the physiology of the pelvic circulation, stimulating the pudendus nerve, and the body starts to respond naturally, physiologically again. Performing massage regularly every day is an act of self-love, a way of saying to the body, I care about myself. I want to recover and be strong again. 1 minute a day, breathing deeply and focusing on the perineal, will ignite your hidden energy, improve your sleep, increase your libido, and boost your confidence. Most importantly, there is no need to feel embarrassed or shy. This is a completely natural, self-healing process, not dependent on drugs or chemicals. Your body has the ability to remember and relearn how to function, as long as you give it the right signals and do it consistently. Understand that each time you put your hand on the perineal, it is not just a physical manipulation, but a deep conversation with your body, an opportunity for you to regain control of your energy and masculinity. When you do it consistently, the improvements will not only be physical, like natural erections, better blood circulation, deeper sleep, but also psychological, helping you feel the confidence, presence, and vitality that radiates through your actions, words, and relationships. Finally, remember, it is never too late to awaken your inner strength. Perineal massage is not just a medical practice, but a declaration that you are still a healthy, strong, and energetic man. Perseverance, awareness, and correct action will help the body to naturally regenerate energy, vitality, and masculinity. This is the message I want to send to all my patients. Strength is not lost, it is just waiting for you to awaken.